Let's talk about subconjunctival or conjunctival hemorrhage. Specifically, what is the treatment? Now, as always, this is for educational purposes only, and if you have any questions at all, please make sure to see your healthcare provider promptly. Now, let's get into it. This is a relatively benign condition of the eye, and it's when a blood vessel breaks, specifically in the white part of the eye. It's kind of like a bruise on the eye. That's a great way to think of it. Different things that can cause it include things like coughing, elevated blood pressure, contact lens use. I've even seen it in individuals who are on anticoagulants, especially if they sneeze hard or they cough hard. Also, sometimes diabetes is a risk factor. And even when you strain to go to the bathroom, that is another thing that can cause it. And I've actually seen that as well. It is not usually accompanied with any kind of eye pain or other symptoms. Eye pain is considered a medical emergency and needs to be evaluated immediately. I always think of things like photophobia, aka light sensitivities, sudden drop or decrease in vision. If you have any kind of eye pain, if there's a curtain or a veil going across your vision, or those are all things that need to be evaluated ASAP. That's just immediately get that evaluated. So what do we do for treatment for a subconjunctival hemorrhage? Most of the time, there's no treatment needed at all. It usually goes away in weeks on its own. And if there is any kind of underlying disorder like hypertension that may be the cause of this, that underlying condition will likely need to be treated. Hope this helps. Make sure to follow along.